that we did today, and I'll go through, there won't be in PowerPoint form, but I will go through and just pick out any questions that weren't answered so well. So with this test, there weren't too many questions, but this was one. So while playing sport, a student twists her ankle, the foot is forcibly everted, which could cause a sprain of which ligament. Now I know that I had an example question in your PowerPoint slides which said inverted. I think everybody just assumed it was the same question, but it actually said everted, and so eversion would sprain a medial ligament. So down here, the eversion would sprain the medial ligament, so that would be your deltoid. Inversion sprains the lateral ligament. So I think that was why you just didn't read the question properly. So the head of the fibula is the insertion of which muscle? So even if you didn't know exact origin and insertion of any of these muscles, you should have realized that A and D are on the medial side, and peroneus longus is in the leg, not the thigh, so its origin can't be, its insertion couldn't be at the top. So by elimination, you should have got biceps femoris without even having studied too much. So a good way, if you don't know exact origin and insertions, by process of elimination, that should have been not too bad. Which of the following muscle tendon is the longest? So remember I mentioned that plantaris has a really long tendon. The muscle doesn't do a lot, and they often use this tendon to put into other parts of the body because we don't really need it, and it's this huge long tendon with this tiny little muscle, the body of the muscle at the top. Which ligament prevents abduction of the hip? So the answer was ischiofemoral. There was only a 50-50 chance of getting this right. Some people put the other answers. So the answer was ischiofemoral. Iliofemoral and pubofemoral, which wasn't in the selections, both abduct. And then the others were transverse ligament, which holds the head of the femur in, and the other one was something else which had nothing to do with. Which of the following abducts the thigh? So it was sartorius, and the rest of the muscles listed there all adducted the thigh. So adductor longus obviously does pectineus and gracilis. So remember they're on the medial part of the thigh, and sartorius is coming from up here, crossing the hip joint, crossing the knee joint, and inserting down there. So the origin, so the insertion is the part that moves. So it abducts the thigh, and it also laterally rotates. So that's just, I did put it, tell you before, that that's the way that most of the muscle questions are formed, and I've put a table on the S drive for you, which lists all the actions of the muscles, and then underneath which one does what. So as long as you learn the tables, you should be able to pick out the one that does the lateral rotation and all the rest will medially rotate. Or this one does abduction, all the rest will adduct. And that's how I write them, rather than just random muscles and then one does something. If that makes sense. So I'm trying to make it so that you recognize which ones do which. And if you think about where they are on the leg, then you can usually work it out. And remember that the insertion is always the part that moves, and the origin is the part that stays still, so that can help you with, okay, it's going to pull like that, okay, it's going to abduct. Which of the following bony structures are connected by the cervical ligament of the foot? So that was a little bit tricky, but it's called the cervical ligament for a reason. What does cervical mean? Neck. So what does it connect? The neck of the talus to the neck of the calcaneus. So it's named for a reason. So that one was actually quite easy. Alright, so this where does, there's no S. The iliotibial tract my weekend stories of woe, because as I was running the Run for Research, I got a really tight iliotibial tract, and I was going around saying, oh, my Gertie's tubercle is really sore. Nobody listened. Gertie's tubercle. My weekend stories are irrelevant. But actually, that did actually happen, and I forgot this was in the test. So Gertie's tubercle is on the tibia. Which one of the following is the medial rotator of the thigh? So again, every other muscle there is a lateral rotator, and the only one that medially rotates is gluteus minimus. Which of the following lymph nodes drain the lymph from the deep areas of the leg and foot? So that is our popliteal nodes, which sit here, and they're draining, or the lymph essentially drains up superiorly into those nodes, and then they drain up into things. So I think the reason that wasn't done very well is because everybody thought, oh, I can't fit in the last lecture. I'm just not going to live. Yeah, maybe. Yeah. That's what I was. Okay, so that is that for anatomy 2. So we're not done. This is my last lecture I give you until July next year. No, so you don't just... so this lecture today, you have a lecture on Thursday from Dr. Bent, who's going to be doing muscles of case studies of the muscles of the lower extremity, which is examinable. And then, so today is my last lecture I give you until second semester next year, where I'll take you for 6 of the neuroscience, neuroscience 3. I take 6 of the papers, and Dr. Cave takes you for the rest of the lectures. So I'll still be around. I just looked. All right. Thanks. Yeah, I say it just to get that response. Okay. So, exam layout for both exams. So, anatomy 2 exam layout. So they're both 90 minutes. So section 1 is your typical, as your MCQ questions. So you've got both typical and diagram based. So remember, so like the ones that we had today for anatomy 3. So similar things, matching labels to the diagram. And then section 2 is worth 43 marks. So there's short answers such as list 4 bursa of the shoulder joint, or name the ligament that completes the acetabulum socket. So just one word or like a tiny little list, those sort of short answer questions. And then there's some diagram based ones. So remember, they'll be the ones that you had in your anatomy Bible. So they'll be there. So perhaps labelling all the joints of the foot or something like that, or the hand, or those kind of questions. So that's anatomy 2, and it covers upper and lower lip for the entire semester. Yep. Oh, sorry, yep. Yes, or the plexes. Yep, that would be another example of a diagram-based question. Yeah, so just the brackets, not the other ones. Yeah, the other ones would be in the multiple choice diagram-based matching. Yep, can't think of anything else that we not pronounced. Yep. Yeah, brachial plexus and any of the ones in our anatomy Bible.
Draw them.
No, not draw them, but put labels onto them. Yep. Yep. So those questions could be as a diagram-based one for multiple choice, or diagram-based for short answer. Yeah. questions. Yes, it covers upper and lower limb. It's pretty evenly distributed. So you've had 2 tests, one for upper limb, one for lower limb. The labs are not tested in the exam because we've already done the practical, but they all interlink anyway. All muscles are free game. But learn that, go and print out the thing that I put on the S-Drive, because that'll be really helpful. Make flashcards. Yep. Sorry? Yes, good luck. Alright, so that's Anatomy 2. Anatomy 3, exam layout. So again, we've got multiple choice, we've got 86 of them. Woo. There's typical ones, and then there's your diagram-based ones. So very similar to the test that you had today. Section 2 is short answers, and Section 2, the short answers are based on the labs that we have done. So remember, the labs weren't assessed by a practical rat race, so instead they're going to be assessed as short answer questions in the final exam. So the short answers are worth 29 marks, and it's divided into 2 questions, so based on the labs. So it could be the eye, the ear, the whatever, all the labs that we've done. Yep. Well, that's on the lab, so possibly. Yep. Yep. So triangles, eye, ear, brain. The ones that we did on the very first ones that we did on the skull, those pictures wouldn't be assessed, but the pictures in the Anatomy 3 Bible will be assessed. Any questions for that one?
So labs plus the Bible for the last section? The Bible's in the first section?
No, not the, sorry, the Bible's in the first section. But the diagram-based won't be a paranasal, sagittal section of the sinus.
Oh, sweet.
So pretty much. I love the labs. Okay, so I'm just going to bear with me. I'm just going to pick out the questions that weren't done well. There were very few people who didn't pass, which is amazing. Didn't. Yes. I'm just entering them, and they're going to be moderated.